Hi, I'm Dr. Schwartz, and today we're going to talk about breast reconstruction with flap or your own tissues. Most women in the United States choose to have an implant-based reconstruction, but 20% of women choose to have flap-based reconstruction. What is a flap? A flap is your own tissue that's usually taken from another part of your body to reconstruct your breast. Usually that tissue comes from your abdomen or your back, depending on where your excess fatty tissues are located. Now, my patient population tends to have a lot of excess fatty tissues around their sides and back, and I tend to focus on flaps that come from the back. Why would you choose to have a flap over an implant? Well, in some women that have had radiation or will require radiation, placing an implant is kind of risky. There's a higher rate of losing your implant or having a reconstructive failure if you have an implant in and you undergo radiation therapy. Flaps are safer in those situations. In addition, implants have a certain lifespan. They don't last forever. Typically, most women that have implant-based reconstructions will require at some point in their life another operation to take out the implant and replace the implant. Flaps typically last forever. Flaps also look more natural. They're your own tissues and they match your other breasts better than an implant would. So we can get a better match to your own tissues when we use your own tissue to reconstruct your breast. In addition, larger women are difficult to reconstruct with implants. We don't have implants that are large enough to reconstruct our largest women, and flap reconstructions are more appropriate in them. In addition, patient satisfaction tends to be better with flap surgery. When we look at women 10, 20, and 30 years after their mastectomy and reconstruction, women who had flaps are happier and more satisfied than women who had implants. Now, the recovery is a little bit longer with a flap reconstruction because we need to harvest the tissue from another part of your body, make an incision there, and you need to heal there. I tend to, again, make that incision in your bra line, going all the way to your back, so it's a hidden incision, and you recover from that quickly. I typically perform most of my mastectomies and reconstructions in my ambulatory surgery center in less than 3 hours. So we can typically remove your breast and reconstruct you with your own tissue in less than 3 hours and send you home that same day. Thank you for watching. If you like this video, don't forget to subscribe and hit the notification button.